Hi everybody, this is Kelly Ricketts, and today I'm going to be talking about bottle feeding babies. My question for you all is, have you ever thought about how you're going to choose to feed your baby once you have children? And it may not be something that all of us are thinking about right now a lot, especially if you're not having kids at the moment, or don't plan to have children for a few more years, but it's definitely a good thing to think about here and there and do some research on, to prepare yourself for when the big day comes that you do have children. My involvement with this topic is that I'm a postpartum doula. For anybody that doesn't know what that is, I help families in the postpartum period, so I meet them at their houses after they give birth. I help teach parents about feeding their babies and help them with feeding their babies. I'm also a lactation student, so I'm seeing multiple clients a week, specifically just talking about their plan for feeding their babies, helping them breastfeed, bottle feed, and I'm teaching them strategies and techniques on the best way to bottle feed babies. So today I'm going to be talking about the best way to bottle feed babies, especially newborn babies. And at 3 months old, approximately half of the babies in the US will be bottle fed, either full-time or just having a bottle at some point. So why do people feed their baby a bottle? Some parents have breastfeeding struggles. They're having complications with their milk coming in after giving birth. Or the baby can actually have complications in their mouth. They can have a lip tie, a tongue tie, a cheek tie, which makes it harder for them to open their mouths wide and be able to feed correctly. And sometimes parents are taking a medication that will interfere with breastfeeding, so they will choose to bottle feed instead. Another reason is sometimes babies' pediatricians recommend supplementing with formula, especially if the baby needs to gain weight, needs to grow more. And then another reason is because bottle feeding is a great way to give the breastfeeding parent a break. So if mom is breastfeeding the baby, then dad will sometimes step in once or twice a night, once or twice a day, and bottle feed the baby to give his wife, the mom, a break. So I have some bottles here that I can show you, and I have my baby. So one of the first bottles that I have used with babies, and one of the best ones that I like, is called the MAM bottle. I like this one a lot. First of all, it's very easy to clean. The bottom comes off. It's easy to clean with soap and water and scrub. It comes with different sizes of nipples. I like to use the 0 slow flow nipple, so it has a really slow full, so baby isn't getting too much milk at one time. So this is the MAM bottle. The second bottle that I'm going to be talking about is the Dr. Brown bottle. This is a great bottle for all kinds of babies. This is the standard that they make, and they also have a nipple that has more of a gradual slope and is great for breastfeeding babies. Something that's great about the Dr. Brown's bottle is it has this internal venting system inside. It kind of helps the air be released out of the bottle so the baby is not swallowing the air, because that will contribute to the baby having lots of burping and gas and might make the baby very uncomfortable. The third bottle that I love is the Philips Advent bottle. This also has air vents on the sides, so the air can come out of the bottle so the baby's not ingesting too much air. It has a very low chance of leaking, and this is very easy to clean also. And the fourth bottle that I really like for feeding babies, which I don't have with me, is the Comotomo bottle. It's kind of a bigger, wide, open bottle, and it's easy to clean. It has a gradual slope, so it's great for breastfed babies. Those are just some of the bottles that I like the best, especially with breastfed babies. So it is not too hard to switch back and forth between the mom nursing and the baby taking a bottle as well. What I'm also going to be talking about is clever techniques to feed the baby with a bottle. One good tip is to take frequent breaks, because with a bottle, it normally has a faster flow than the nipple of somebody's breast, so the milk could be coming out of the bottle very fast and the baby can't keep up, and it'll cause them to choke on the milk or eat too fast, and then they'll have lots of spit up or have an uncomfortable stomach. You could take breaks with a pacifier, so the baby, you could take the bottle away, the baby stops feeding, they could get a little angry because they really want their bottle, but what I like to do is put a pacifier in, and we'll do a burping break, just to kind of prolong the feed to make sure that the baby's not getting too much at once, and that'll upset their stomach. A method that is great for bottle feeding is called paced bottle feeding. So for this, instead of having your baby laying down, because that makes it so the milk is just flowing out very fast into their mouth, is to keep the baby more upright. So we'll hold the baby more upright, and instead of tipping the bottle all the way up, we'll hold the bottle horizontal, just enough milk to fill the nipple. And this way the milk isn't just kind of pouring out into the baby's mouth, and the baby is controlling the feed. And after feeding, it's great to have the baby sit up for anywhere from 15 to 30 minutes. So you can hold them sitting up here. Just laying them back down is a bigger chance for them to spit up or feel uncomfortable. You could walk around with your baby holding them, standing up. It just makes it so it's easier on their stomach and it's not too much movement. I like to wait about 15 minutes and then I'll try to do the diaper change instead of doing the diaper change right away, just to make sure that it'll be easy on their stomach. Bottle feeding challenges are something that isn't talked about a lot, but my work as a postpartum doula, I've seen a lot of families struggle with having their baby take a bottle. Sometimes the baby doesn't want the bottle, they want a specific bottle, they're having trouble with gas and burping and spitting up a lot. 7 out of 12 of my clients that I've had, their babies have had bottle feeding difficulties, so we've had to work through that. And as new parents, especially, it's just a very changing time and everything is so new. And the more you know about bottle feeding your baby, the less stressful it will be, because the postpartum period can be a very overwhelming time. But the people in my career field, so infant feeding specialists, lactation consultants, postpartum doulas, are all here to help you and to give you all the tricks and tips with bottle feeding your baby.